Hi, I'm Dr. Charles Denham. Today's briefing is regarding the Med Tac program called Lifeguard-Surf. It is a program where we're helping lifeguards and first responders in coastal communities help train bystanders in critical life-saving skills and knowledge that address the high-impact healthcare hazards that can happen along waterways.
The Medical Tactical Certificate Program, called Med Tac for short, focuses on 8 of the leading causes of preventable death to children, youth, and otherwise healthy adults. The coastlines and inland waterways of the U.S. and around the world are a great attraction for recreation. However, they expose the public to unique threats that lifeguards and first responders encounter every single day. And due to the geography, there's often a greater delay for emergency medical services to get on the scene, whether there are lifeguards on duty or not. These unique threats provide a terrific opportunity for bystander care to save lives before professional first responders arrive. Working in collaboration with lifeguards and first responders at some of the most highly frequented beaches in California, Hawaii, and Florida, the Med Tac team of medical, law enforcement, and biomedical engineering experts and scout leaders with ocean rescue experience are piloting bystander care programs on our coastlines. The goal is to help the public work with professional first responders to diving accidents requiring rescue divers and immediate care at remote locations, surfing accidents with injuries and trauma due to surge events, mass casualty events along the coastline or resort locations, and to address the 8 leading causes of preventable death that can occur in any location that can even be more impactful to isolated individuals in remote locations or at public events where the masses are vulnerable targets to those who want to inflict harm to groups. Clearly, the knowledge of CPR and the use of automated external defibrillators are in the wheelhouse of the non-medical bystanders for near-drowning victims. However, there are important considerations unique to performing these skills in the beach or water environment. There are uniquely important injuries from sea creatures that divers, swimmers, hikers, and surfers may encounter that are life-threatening or causes of temporary or permanent harm, especially if the victims have allergies and are at the risk for life-threatening anaphylaxis. Even hikers can be at risk from falling rock along our coastlines, such as the case of a teenager in one of our pilot regions whose life was saved with bleeding control techniques when he nearly lost his arm from a falling rock in the summer of 2018. Surfing combines speed, hard objects, underwater obstructions, and the opportunity for bodies to collide. The most common injuries of surfers, whether in competition or recreationally, are to the head and extremities, with lacerations or cuts, contusions and bruising, sprains and strains, and fractures happening very frequently. The face and head are often the most common sites of the cuts, bruises, and fractures. Not infrequently are there injuries to the spine with certain types of waves that break closely on shore. Cervical spine fractures can be life-threatening and can lead to paralysis, where ocean rescue methods are absolutely critical. A unique care pack of emergency supplies has been developed for those along our coastlines and waterways. It's a refinement of the original design we developed for schools. And a small bystander care kit is being piloted that can be carried by individuals with what they need for typical minor and major injuries, including tourniquets, waterproof bandages, and antibiotic ointment. A water-resistant and weatherproof outdoor emergency supply kit that the team is calling a Med Tac Care Case is being piloted on the California coastline. It will be accessible at lifeguard towers for lifeguards, as well as for the public and first responders when lifeguards are not on duty. It contains an AED, stop-the-bleed supplies including tourniquets, anticoagulant gauze for wound packing, bandages, and personal protective devices for bystander care providers and professional first responders. A new combined signage system directing the public to both AEDs and the bleeding control supplies were developed through a Boy Scout Entrepreneurship Merit Badge project in Southern California. Lifeguard and ocean rescue experts are ideal Med Tac instructors with their training in CPR, use of AEDs, and knowledge regarding keeping the airways clear. The Med Tac team is engaging these professional first responders to become certified CPR AED instructors and stop the bleed instructors to join the Med Tac team. This will allow them to develop and sustain bystander care know-how in the communities they serve. In both California and Hawaii, tourniquets and emergency care supplies are being provided to lifeguard groups through the Med Tac philanthropists and supporters in their communities. If bystander care can truly be driven and sustained locally, this will drive life-saving globally. That is the vision of the Med Tac Lifeguard-Surf Program.